Hi there, and thank you for joining Mastering Today's Crown Prep, practical tips to improve accuracy and efficiency. My name is Dr. Lori Trost, and I will be presenting the program. Just a little bit about me. I practice comprehensive restorative dentistry in the greater St. Louis, Missouri area. I'd like to take this opportunity and thank those responsible for making this program happen, especially under all of our current circumstances. Thanks to Premier Dental Products for their invitation to give this program, and also to Viva Learning for their commitment to education. You know, it's interesting, from prep to seat, single crown units continue to anchor every dental practice with their time, their production, and the energy it takes really to make them happen. They are the largest billable restorative procedure in our dental practices today. They account for approximately 45% of all of our total office production. The average office performs about 256 single unit crowns a year. So basically that fractions into around 21 a month. So this is a procedure that we do very often. It's a procedure that we need to learn how to do well, and it has significant impact on our schedules, as well as our patients, and obviously our bottom line. I don't know about you, but I really do not like taking analog or traditional type PVS impressions. So since I've been going digital, which I have now for quite some years, I've really just my practice has catapulted and really benefited from a multitude of an array of just really great results. And I want to share a lot of what that digital realm means. But more importantly, for those of you who are still doing traditional impressions, I'm going to give you some insight on how that process can make it better for you and work with your lab, and to really offer more solid and predictable bread and butter dentistry tips. So that's where we're going to kind of really make this conversation go to. I'm going to offer really practical ideas to develop a very systematic approach to every indirect procedure that you do. I think the more that we can standardize things and keep everything very consistent, I think the better off we can have results for patients. More importantly, we create lessen the chaos for us in our own practices, have a more fluid workflow with our assistants. I think it just makes for a better result, obviously, just all the way around. I really want to talk about, too, how to optimize burr selection and really minimize your time in thinking about how and what you need to use. You can really pare down to specifics and really use that 80-20 principles and really make a very excellent preparation with that in mind. And I also want to talk too about predictable tissue management. And this is an issue that many of us, and we all have challenges. I don't care what kind of and where you are and how you practice, everyone has challenges with tissue management. So I'm going to show some tips on that as well. And I really want to talk about certain key elements that are in identifiable with scanning, and what you need to think about if in fact you're doing traditional impressions, and how those move into the digital realm with your lab, and what you need to prepare for and understand. And then finally, I'll talk about some material and ceramic choices, along with how do we finally place these restorations. We want them to be durable, obviously. We want to make sure they're secure, but along that path and journey, before you can even finally place that, you want to really make sure you lessen adjustments, and any adjustments that could be needed. And so I've got some tips and some ideas on strategies on how to really make that a much more predictable and easier, less chaotic type of delivery. And I think that's just really important. We'll talk a little bit too about some of the current cement chemistries that are in the market, and really, honestly, try to navigate that, because there's so many questions about cements now. So we'll make that happen and really roll that out and make that a much easier discussion for you to understand and to go with. So whether you take a traditional style PVS impression, like you can see here on the bottom picture of this, or in fact, if you do scan, what you've got to understand is right now, traditional analog or traditional just PVS, like we're talking about, polyether, or you're doing the scanning, when that goes to the lab in today's world, what's happening is that is most likely going to go to the lab, and it will have and be scanned if it is an analog style type impression. And labs are all trending this direction. They place these on tabletop scanners. The impression is scanned, and then it's created a digital model and goes into digital mode. Therefore, it is designed digitally. So you've got to be aware that that's absolutely happening today, and it's really the future. Most labs are doing this now, and I know almost all of the larger labs are. It saves time. It creates enormous accuracy with and the precision in which they can fabricate these restorations. But with that in mind, you've got to make sure that you work with your lab and your ceramist. You understand the kind of design you want. So you do have control over what type and how heavy you want your contacts, what style contact that you want, what type of occlusion that you want, et cetera. So make sure that you have those kind of elements in your mind when you're asking and writing down what you want on your lab prescription for that specific restoration. And then, of course, once everything's been scanned, obviously it's going to be milled. And in today's world, we do dry milling, we do wet milling. So in my world, I personally do not do chairside milling. I have a lab do that. I think they're really keen in that element. And I find that I can get exceptionally good results with them doing this. And I'll explain a little bit more of that in a bit, but I just think that's a really good work style and workflow for my practice. So patients do in fact have temporaries that they wear home and they come back, and then we place the permanent restoration a little bit later on. So that is a very traditional workflow of what many of us do in everyday dentistry. And obviously we finalize and finish. So the key is to really minimize at that end point what is needed to seat that restoration and to really make a successful delivery and a durable restoration for long term. You can see here, there's a variety of scanners that are on the market today. The top three that you see here, the True Definition, iTero, and Medit, all of those are, many of these right now are tabletop, they can have carts, but the top three work basically, the scan is taken and then it goes into another site in which an STL file, which in fact it goes and is transferred and then obviously scanned, you name it all, transferred, and it's made into its design, and then it's whatever it's being done and being used for, it's going to go forward with the lab there. The lower three, the Trios, the Planmeca, as well as the CEREC Prime Scan, those three have systems in which they can connect to chairside milling. So those are what's on the market today. These are the leaders. And I can just say on a broad realm now that digital scanning is extremely accurate, is extremely predictable. If you are in the market, I encourage you to do your homework, talk to your colleagues, talk to reps, have them bring a scanner in, see what works best, see what they offer. These scanners are just amazing and how they can really create a workflow. Some are able to do, some have speed, some have carts, some have a better feel in your hand. Everyone has their preferences. So you need to really identify what works best and well within your own practice. And obviously who on your teammates and your members, what they like and what they're going to be able to use as well too. So again, some of these systems are open, some are closed. Do your homework, talk to your lab, start there with some good points, talk to colleagues, and really jump into that. I really encourage you to do that because regardless of what system, this is the future and this is where we are going. And I just really think it raises the level of dentistry. And you can see here some great studies that are out recently, 2020 here, 2017, 2018, just how scanners, digital scanning is influencing our workflow, and more importantly, how amazing it's just really helping us create just restorations that are extremely accurate. Rarely, it's just, I think once you get that workflow down and the kind of design and the style of the dentistry you're doing, and you work with your ceramist, if you're scanning, you can really nail and really par down. Remakes are just not the thing. You can really see that immediate feedback from a scan. You can really tell if you need to reduce more, or maybe you don't have a clear margin. That immediate feedback is just so exceptionally good. And it just makes us all, I think, a better dentist. Here's a prime scan. You can see here quickly how nice and fast this scan is made. I'm not here to say one scanner over the other, but the speed is just amazing and how quickly you can do this. And patients really realize how nice this is, not having all that impression material in their mouth. They're amazed by this technology. Obviously, it's very transparent because they can see clearly what they're scanning, and it gets them extremely excited about the level of dentistry and care that you're doing for them. So I just think, I just love this. This gets me excited about dentistry, and just the possibilities are really, truly endless, and it only keeps getting better. So if you haven't jumped in, I really encourage you to go and try this. So like I mentioned earlier, I think it's so important you understand how milling from a lab standpoint can be such a benefit, because I think the design that they can create and the quality is superb from what I can do. They do this all day long. And for my workflow, it would really interrupt my schedule. So this is something I've adopted where I do the scanning, send it to them, they mill, they design and mill, and we go from there. Like I mentioned earlier, the instant feedback is unbelievable because it affords us the ability to say and look at a scan and identify all of the elements that we absolutely need to make that a very successful restoration. And I've practiced long enough that I can share. There's times where I've under-reduced. There's times where I didn't have enough clear margin. There's times where I didn't see the margin. Honestly, to have a model that you can look at immediately and see that preparation, and to know your line angles, or maybe your reduction, or maybe the clarity, everything right there, to toggle that, to look at it, to inspect it before you send it off. I just think more eyes on it, you can see what you need to see and understand. The better restoration, the better for the patient. I also like the idea too about the turnaround time, because I think once you get your system and your workflow down, once you send that scan off, early in my office or in temporary, more than 5 days at the longest. So that minimizes that. Probably the biggest thing that I really find advantageous wise is that material choices for milling are really more broad spectrum. You can have zirconia, is one of the largest material choices we make today, and you're able to make sure that milling is done properly and on a very robust milling machine. So I just like the ability that a lab itself is doing that and really creating a very fine restoration. So that's I think just super good feedback. Working with the lab, having the maximum amount of choices, and just making myself a better dentist. There's that influence how restoration fits. And this is interesting because I want to dive into what we can identify how that final restoration. I really want to help you avoid any type of adjustments, even remix, because remix, all of this is a drag on our time. And there's no time right now to understand how we can identify what little factors can give us little glitches, little hiccups. And especially during everything we've been through with this pandemic, we understand how valuable our time is, and you want to be able to maximize what you can with that patient when you can. So prep design is really critical, and we're going to dive into that a little bit more, but there are certain things that you can make sure of your preparations, that when you capture that data, and this can be traditional impressions, analog, or with a scanner, that you make sure and you ensure that certain elements of that prep are completely smooth. And we'll talk about that, and refine and smooth and round the angles. But it does make an enormous amount of difference, because even again, if you're doing traditional impressions, that impression is going to be scanned by a tabletop scanner in that lab. And they're doing that. They need to make sure and ensure that you have that smoothness of that preparation. So we'll talk a little bit about that. And you'll see some ideas here in just a bit. We'll talk about as well. But good prep design has to have identifiable margins, and you've got to be able to manage that tissue. We'll really I'll show some ideas on that, as well as exposing and be as good as that prep allows. So you can't have undercuts, and undulations are really contraindicated. So super important about that. I'll also talk a little bit about how that restoration from a standpoint in the lens from a ceramist and from their lab angle, and to understand what they need in order to create a very fine restoration for you. And there's some key elements there with that. And finally, we'll talk about the securing of that restoration and different types of cements, different choices. What's the thought process? How do you arrive at what process of cementing you need to do? Do I need to do traditional cementing? Do I need to bond it? What's needed and why? Those types of things. Let's dive into preps first here. I want to talk about that initially. And before I go further on that, I do want to mention about buildups, because buildups are a very significant factor for many of our crown preparations. And I get asked often, what do you use for buildups? And I personally do not use traditional style composite underneath. I want to use a material that is built for a buildup. You can see here, I've got great isolation on this older amalgam that was removed off of number 19, lower left first molar. You can see here the decay is out. We're going to go ahead and actually, I'm going to use chlorhexidine on that initially. Got it completely isolated. I'm going to do a selective etch style method. I'm going to do a bond, selective etch and selective universal bond on that as well. Scrub that in, lightly air it, thin it, light cure it, and then I'm going to go ahead and use CompCore AF. And I have to be honest, this is a material that I absolutely think is one of the best materials I've ever used in my long career with cutting, and it performs just like cutting and dentin. I can honestly say that it performs extremely well. Some of the materials that you can actually use today are you can actually feel ditching when you're prepping the tooth, because there's just such a difference in material feel between the tooth and the material itself that you end up edging or ditching into that material. That's not the case here. This actually feels just like dentin when you're cutting it. So to me, that's a really valuable thing. Plus, it has really a lot of less polymerization shrinkage. It's like 33% less. So that is really important too, because you're getting a very solid restoration underneath your final restoration. So an indirect restoration. So very, very important there. Along with that, you've got the ability, this is dual cure. So depth of cure obviously is always in our minds, but this in 4.5 minutes will be finally set on its own in an automatic cure. So of course, I'm going to do light curing as well, but the factor that I know that I have a thorough cure is really critical here for what I'm doing and using it for. So really important to have a good buildup in your toolkit, and I can't recommend CompCore enough. It's a great, great product. So some of the design principles we have today for our ceramics, our zirconias, we absolutely have to have rounded internal angles. I think most of us understand now you cannot have sharpness. And I'll give an example of this in a little bit here, but really critical to understand everything must be rounded. Again, adequate thickness. This is one of the beautiful things about the scanners today too. If you're using a scanner, you totally understand how you can understand how the occlusal, how the cusps meet, excursions, and you're able to get immediate feedback on how much reduction has actually happened there. And you can see that you have the adequate thickness for whatever ceramic you are using. And I know often there's gauges out there, there's different things, but to have that precision from that machine and that digital data capture, to me, is so valuable. And I really like that. That's one of my favorite things about using a digital scanners, because I get immediate feedback how much reduction I've actually achieved, and know and I'm secure with my choice here for ceramics. Smooth transitions, again, smooth transitions, and that refers mainly to how circumferentially they're smooth, but more importantly, how smooth it is and flowing out onto the margins as well too. So no sharp 90-degree angles, no sharpness. We want to have everything rounded and flowing, and that's going to really provide the best preparation for a lab to properly mill. The largest, I think, probably a violation that we have, and when you talk to labs, that they will tell you that most people, and this is across the board, they will find that the lack of reduction is the #1 pitfall of every preparation, especially on second molars, even first molars. And we have to have adequate reduction. Now, when I tell you that, I do not infer whatsoever that you need to overly reduce and grossly reduce. You need to do very methodical, measured reduction. And I think you need to do it very systematically. And I'm going to show you a couple methods in that in just a bit, but lack of reduction is still the #1 issue. So use your digital scanner, have feedback with your lab, use different gauges if you're just doing traditional or analog style impressions. But work with gauges, make sure that you have the adequate reduction, because you do need that proper material thickness to have the strength and the durability for whatever you're choosing. Also, defined margins are often not defined. And I'll show some tips on this and make that happen as well, and really work with that, as well as undercuts or undulations, like I mentioned earlier. And another thing that really is a pitfall of many preparations is overheated tooth structure. It was interesting. I was on a chat room here over the weekend. Honestly, it was Dentaltown, and someone had asked the question about they're having sensitivity issues with patients having crown preparations, postoperative sensitivity. And I can honestly say I do not have that. And meanwhile, several people started jumping on that chat line and they started discussing what could happen. And the reason that teeth get overheated is often there's not enough water flow. The proper RPMs are not being dialed in correctly. So there's a couple of combinations of things, but regardless of what's happening, we can identify those in a bit. Overheating tooth structure can lead to postoperative sensitivity. So we can avoid that. We can do some other things to really make it better and easier. I really encourage you to dial up your water. So let's talk about preps. I want to kind of work with how do we systematically standardize how we prep a tooth. We all know dimensions right now of reduction. We need occlusally 1.5 millimeters to 2 millimeters of occlusal reduction. Incisal reduction, critical that we have this. So often I will take a flat end taper diamond burr, simple and easy, and go ahead and create depth cuts. And you can see here, this is going to give me about a 1.2 millimeters of the depth cut. And I know I'm very, very close into already getting into that zone of proper reduction for adequate material thickness. Very important. So you can see here, I'm working on this molar, and I'm going to go ahead and just do basic depth cuts. That's always a good place to start. And from there, I know that I can start to connect those depth grooves and flatten out that occlusal and follow the anatomy of that tooth. And that's exactly how I start every preparation, no matter where I'm at in the mouth. It's exactly where I start, occlusal or incisal. And I think that's really, really important. So these are measured depth cuts, essentially. I'm using my burr because of the measurement, the diameter it is. This is what I'm going to absolutely use. Next, I'm going to go ahead and I'm going to go and tackle that interproximal clearance. And this is really an important step because, first of all, this critical area, you need to make sure that you have the proper speed in your handpiece because you're going to be cutting through a significant portion of that tooth. So you really need to have good visibility. You need to make sure that your burr doesn't clog. You need to have good water flow, good vision for those surfaces, because the last thing you want to do is have a situation where you nick or edge an adjacent tooth or restoration. So for this choice, I always like to use a flame-shaped burr. So my second step is use that flame-shaped burr and make those interproximal clearance areas. Make sure too that you realize you need at least 1.5 millimeters of axial clearance for adequate ceramic thickness, again, on your preparations of your to create those burrs measurements again, and for the proper restoration thickness and adequate thickness in those areas. You can see here I'm using Solo Diamonds. I like to use one and done burrs on these preparations because I like to have the ability to, one, have a fresh burr that can make really amazing slices, especially in these areas. Another little trick I've learned, I like to use a wedge guard often. I will place this and I will, especially against a gold crown or another, maybe perhaps ceramic crown, but these wedge guards are terrific. You can slot these in approximately. Go ahead and take your flame-shaped burr and go past that, and you are confident you're not going to nick that adjacent restoration. Just a super, to me, that's just simple and easy to do, but it saves yourself so much time because I don't know about you, but I've had to go back before and polish or try to smooth off something that I've nicked, and it's really, really difficult to get a very good shine and polish on something. So just save yourself the hassle, put a wedge guard in there, don't worry about it. Use Solo Diamonds. These are tremendous diamonds. They really work extremely well. More importantly, they, for infection control reasons in today's world, these are your go-tos, or they should be, because they really, really work well. Problems with reuse right now, obviously, it's going to diminish your cutting effectiveness. I don't know even how you get that diamond surface clean, honestly. To think about procedurally reusing these, I just don't want to. I don't want to go there. I want to be able to have everything be sterile, clean. I want to have a one and done, and really make sure that my patients are very well taken care of more than ever now. And the last thing I'm going to do is pay an assistant to try to scrub these or ultrasound these and then reuse them for two reasons. One, you don't know how many times you do use them, and secondly, you've lost your cutting effectiveness. So if you can stick to Solo Diamonds, I think you're just far better off, and just have a great, effective cutting surface that works just when you need the demands of making it happen. It will happen that way. Step 3, I'm going to go ahead and do some of my final reduction. You can see here, I do a couple different methods here. For one is a flat end taper diamond that I will use on the facial or buccal surfaces, and again, depending on the emergence profile, I will go ahead and do my final gross reduction there. With that, sometimes I also use a football on like the buccal or lingual aspects on a molar, and that tends to work very well too. And I'm not working on any kind of margins right now, but these are just getting the line angles properly. Again, making sure that the preparation is lining up with the line angles, emergence profile, you name it, and not creating any margins with these yet. But that's my next reduction. Here's that thing about turning up the water. Absolutely, certainly important. The problem with not having enough water flow, your burrs do get clogged. Tooth debris is on the tooth. More so, it really affects your visibility of the prep. The other problem that you have is again, that overheating and that postoperative sensitivity. So you really don't want to compromise your visibility. I mean, that's one of the biggest things. So if you are having issues or postoperative sensitivity, turn up the water on your handpiece, and I think you'll realize that your cutting will be better. You'll minimize your clogging. Yeah, you keep that tooth nice and cool, and it really creates a more efficient cutting ability on these burrs, because there is a lot of heat that builds up on these diamond burr surfaces, and you got to make sure that you're doing that cutting effectively, and you're doing that in good visibility. So save yourself the time and hassle, turn up your water, and I think that will be a big win for all of those involved, patient and yourself too. Now I'm going to step into margination, because this is so critical. Margins are defined by the incredible ceramics that we do, but really the margins are your signature today for all of your restorations. And you can see here, this type of margin that's done and used with a modified shoulder diamond is probably the most common that labs see. The key here is to make sure that you have a margin that has about a 1.5 to 1.5 millimeter definition in it. And that delineation is ideal for not only the scanner to pick up, but also for your ceramic to be able to be sealed when it's placed, whether it's adhesive or if it's cemented. So again, you do not want to have any type of sharp angles anymore. That's old school. These ceramics need to have rounded angles. And again, you can see this is all suitable for all the ceramics and all the CAD/CAM type restorations today that are on the market right now. So what do you want to avoid and make sure that you do not trap yourself? And in the past, we would take maybe like a round end diamond and we go over our margins. But the problem with that is it likes to create a type of a J hook appearance. And what happens then is the scanner will not be able to read that, one, clearly. Two, the ceramic will not be able to mill in that very thin fin that you can see here on the left side of the picture. And so then you're going to have a problem, because you're not going to have a restoration that does not seat correctly. And you're going to have a restoration that will have a very thin area and edge on it, and it really will lend itself to being fractured. So when you go to seat it, so you've got a no-win situation. So if you're using this style of margination, this could be a problem here for this right here could lessen your remix. So what you need to do is switch to a modified round end and a modified shoulder type restoration. This will not create that J hook that we're talking about. So therefore the scanner can read that easily. And honestly, you're gonna be able to pick that up much better too with your traditional or analog style impressions. And this will really lessen your hassle. When you're marginating and doing that finalization, I like to definitely slow, and I like to use electric cam pieces. I have air as well driven too, but my electric cam piece, I will dial it down. I'll do a setting of 1.5, 1 to 5, and go down and literally 40 to 50,000 RPMs. I will move around that margin as the burr's rotating in a clockwise motion. I will go counterclockwise circumferentially, and I will create my margin and smooth out my margin and really make sure that it's refined and defined clearly here. So you can see here's a common example of a margin, margin of a molar prep that we've done here, and how it's laid out. But again, try that method. I think when you move in that counterclockwise motion, you have a better feel of that burr in the handpiece. So if you can slow down, dial that down, especially if you're using electrics, I really think that feel and that tactile sensibility is really amazing. And I think this method too, really, it helps you reduce any kind of ditching or ledging that happens when you're doing that final margin finalization. So try that. I think that feel and that technique really works very, very well. I want to talk a little bit here too about the value of having smooth preparations. Again, I like to take at the very end, once I've got my preparation and the margins are clear, I'll often take like a Dura white stone here, as you can see, and I'm going to go ahead and I will make sure I go over all my preparations and make sure they're very, very fine. You can also use a fine or a super fine diamond as well. Again, you don't want to touch your margins with this because your margins are completed, but you just want to get the facial and lingual and axial or interproximal surfaces and make sure they're nice and smooth. And this really sets the stage for that scanner or as well as traditional impressions to read that preparation much, much better. And I kind of akin this to processes whereby you're you're using a sawzall, which can make a very clean cut, versus some traditional saw where you're going back and forth, and you can make a much cleaner, easier cut if you're using it like a sawzall. You can see here on the left side. So I use a lot of building analogies when I'm talking, and I think this really is a very good example that you want to have things that are slick and smooth and a clean cut versus something that can drag that edge and maybe roughen that, and really makes a big difference. You ask, why is this so important? Because here's what you need to understand. There's been several studies that indicate that definitely the bond strengths to finally prepare two structure that are very smooth are going to be better versus a coarse diamond. And if you think about it, it does make sense because, again, if you look at scanners, you look at traditional analog type impressions, you're going to look at a material that has to flow and go over those undulations. So if something's rougher, it's going to be more difficult, and the read is going to be different on that. Here again is another study too. So bond strength will definitely increase. And where is this important? When we're placing it in a final restoration phase. So when we're cementing that, if we're doing adhesive bonding, however we're choosing to place that into its final state and securing it, if you have a smooth surface, you're going to have a much, much better result in bond strength to that restoration and that tooth and that interface. Super critical. So here's an example of a preparation that was done, sent into a lab that I work with, and they want to illustrate here that even though this dentist has the ability to mark the margins, they missed the margins. You can see here what you've learned already. You can't have undercuts. You can't have those undulations. The irregularities on the surface make it almost impossible to properly mill. And so you need to have, again, smooth preparations, clearly defined delineated margins, and a much better result will happen. I mean, this most likely would debond just because of the way the margins are placed, and it's not even covered. I mean, I don't even know why this would be made to begin with. I think we're going to have the dentist redo it, but you can see here how we can improve on that. So you want to ask why here. So think about, again, from the milling aspect and from the lab's standpoint. If you have sharp angles, here you can see if you do a cross section here of this restoration and this prep, you can see here with the sharpness of this occlusal reduction, you've got areas here that are really very prone to fracturing. So think again forward how the restoration is going to be when it's made, and the detail of this, you can understand it clearly. When occlusal forces are on this restoration, the chances of fracturing are going to be much, much greater just by the design of how this wasn't rounded and how this wasn't properly reduced. So again, another reason and another effect to go into the digital realm. I want to talk a little bit about cases that require multiple preps. I love to use a package of burrs. Again, I don't have to go looking for these things. I don't even worry about a burr block. I want to have all of my diamonds right there. And to me, when I'm doing multiple preparations, many of us are doing that now with quadrant style dentistries, with everything going on, we want to be able to maximize what we can do for that patient. We can have to use burrs that allow us to do that quadrant level of dentistry. So to me, 2 stripers are my go-to for these areas. They have incredible durability. And the biggest thing is, they just don't lose their diamond particles. When you're cutting and you're using them, they're very efficient. Even during the multiple preps, the first prep is going to be as good as the third prep. And that to me is really amazing. And more importantly, it's been proven scientifically. So, when you're looking at diamonds, the anatomy of a diamond burr, often, they're designed to remove that gross tooth structure. And depending on how they're fabricated and manufactured, many of them consist of kind of like of a metal blank that they have powdered abrasives, diamond abrasives that are metallurgically like bonded onto the surface, or sometimes they're even electroplated. So regardless, electroplated diamonds will definitely cut less consistently, and they have a shorter period of clinical life. So you can see here on the left the example of what an electroplated brand would be, versus if you're going to use a brand that's going to, and honestly, the burrs are totally different, and you need to look at the value, and you need to look at what the efficiency of these are, because you might go through 2 electroplated brands, and guess what? You could have been using one that was done a little bit different in its processing, and guess what? You're still being able to use that on that third prep. So again, make sure that you understand apples to apples and how these really, really can make a big difference. But often in the manufacturing, just because of how it's manufactured, you're going to lose the diamonds, and you get dislodgement of these diamonds, so therefore you lose your cutting efficiency. So it's really, really important to understand you want to reduce the heat and friction, raise up your water, get a good quality burr, and get a select grade of diamonds that have a very good process, which they've been manufactured by, and they hold their integrity, their cutting integrity, and really you're able to benefit from that. Very important. Save yourself the hassle. Just make it happen. It's just so much easier. In that little package, I like the idea of what they already present to me. You got my flame, you got the interproximal reducer, you got a football that you can be using for gross reduction or occlusal refinement. You got a flat end taper that you can do your depth grooves with. You have a round that you can even do depth grooves with as well, sometimes even lingual reduction as well. And then you got your round end taper that you're able to use for your margination here. And you can see, again, some preps here that are very standard, zirconia preps. And again, that's what I use. If I'm going to use 2 preps, I'm going to go to a 2-striper. I'm going to be able to use both of those, really be able to have safety first and foremost for my patient, because I know that I'm using a one and done for them. And for myself, assistants don't have to sit there and worry about loading a burr block. We don't have to worry about cleaning. We have a go-to that really just makes the process and procedure so much more efficient. Another thing that I really like too about Premier Dental Products, they have a website that's called findmyburr.com. And if you have questions about maybe the burr line that you're using right now and the numbers, because a lot of this is very confusing, you can actually go there and you can source what brand you have and cross code that and find the brand that perhaps maybe would be ideal in the Premier line. So I really like that ability to do that. And I think that's a very good offering, because the more we can cut down our confusion and chaos, I think all the better that we can do our dentistry and really focus on what we need to focus on. Really important too, I talked a little bit earlier about that cycle of efficiency and how the shape of the diamond burr changes, because when you rev up your speed, obviously you're going to start losing particles, and that burr integrity is going to change. So it's very important to understand that, more importantly, the quality of those diamonds now. So you lose your cutting efficiency, and more importantly, now your cost is going up, because then you're thinking, I'm throwing money out the window because I've got to use another burr and I got to use another burr. So it's really amazing. Get something of value, use a burr that, is going to be really quality, has good integrity. And honestly, a lot of this happens, it's not visible even to our naked eye. And so it's happening right underneath you, and you just don't even realize it's happening. So make some changes there, and I think that can work nicely. Let's talk a little bit about managing tissue. And I know it's so important. It's one of the biggest challenges I think many of us, if you're doing any type of restorative dentistry. And it's really critical, even more so too, when you're taking a digital scan, because you have to have that visualization happen while you're scanning. And the teeth and the tissues and the margins have to be dry, because scanners, I don't care how good they are, they cannot read through blood, saliva, even lapping tissue. They just cannot. So you've got to be able to have a combination of hemostasis and fluid control. and make sure that you have enough displacement of that tissue to really allow for that impression or that scan to happen. So you can see here the difference in these pictures. You can see in the lower picture here how refined that preparation is. It's ideal. We can air that off and we've got everything we need to see. But on the top picture, that's just basically a nightmare to really get that under control, because not only do we expose the margins, but we've got to really get hemostasis and isolation of that area under control before we even consider how to make that happen, before we can get those margins really where we need to be in the whole preparation. So, margin exposure is a really big challenge for all of us, and basic accuracy of any type of impression really hinges on how you expose your margin, how you capture it. So traditional impressions are going to require, that 0.25 to 0.5 millimeter apical visibility. And if you don't have that, then you're going to be losing out. Scans are going to require basically a 0.5 millimeter apical to that margin to be visible. So a little bit different requirements here, whether you're scanning or whether you're doing traditional impressions. Regardless, you've got to have an understanding that you've got to have displacement or dislodgement of that tissue to expose that margin. That's what's really, really very, very important. The thing where this does not play out, if you have supergingival margins or even equigingival margins, soft tissue retraction is not necessary, but you still have to think about isolation. And so with that, you think about having hemostasis. And, honestly, hemostasis is really achieved by a variety of methods. Some of the more favorable ones that are on the market today are different pastes that are present. Here you can see in the upper left picture, you've got Traxident. There's an Expasil as well. You've got different ones that really can flow in around the cellular area. Most of these are made out of a 50% aluminum chloride chemistry. You place these, you need to rinse off the preparation, dry it as best as possible, and place these in around the sulcus. And honestly, you need to let them set undisturbed for about a 2 to 4 minute placement. Beware that some of these that are on the market today will discolor the tissue if you leave them on longer than 4 minutes. So beware of that, okay? And also the other factor I think that differentiates these is how easily these can rinse off. So it's well and fine when it's against the tissue, but the other factor you need to consider when you choose one of these is how easily will this be able to be removed when you go to take that impression or that scan, make that. So Traxident I find to be a great winner. It's easy to rinse off. I often use a micro brush, and we get a very nice result with that. Expasil is a little bit thicker. It has kaolin in it, and it has more of a clay consistency, so it's a little tougher to remove. Pressure is another great combination here. Retraction caps here by Premier. I love to use these because you have an anatomic form, whether it's a premolar, an incisor, or molar. And honestly, I'll take often the Traxident, place it, and then I'll take this retraction cap, and I'll go ahead and have the patient just close down on that. And just by the mere virtue of that pressure, that in combination with the Traxident works extremely well. I also like the idea that the patient can rest and just kind of take it easy because they've had their mouth open for a little bit. So this is just kind of a nice combination in making that happen. I think that works out very well. You can see here's Traxident in clinical play here. You can see exactly, we've got some interproximal oozing here and bleeding, and you can see how this is able to hold us and stay this off. We're going to go ahead and place those retraction caps you can see here, and nice, and then you can see the final picture here where that tissue is in great control. Everything's isolated there, and that was actually after we took the scan. It was not immediate. So again, it's held its oozing and any kind of bleeding that we had to really be concerned about. But again, that's just good, solid clinical dentistry. Retraction cords, so very, very important. It's necessary that when you have either an equigingival or subgingival preparation, you really have to visit some type and form of retraction around that preparation. So, there's a wide variety of retraction cords on the market today. Personally, I find that knitted cords, they offer an easier placement just by virtue of their design. They don't unravel. They stay placed easier. And my go-to is a knit pack cord. I find that to be an excellent choice here. I like how it has a little cutter in the cap. My assistant actually likes it probably more than I do. And these are just easy to place, and they're just they're a terrific retraction cord. There's forms that are out there that are impregnated or non impregnated. I usually use an impregnated style form. But again, aluminum chloride is usually, again, the hemostatic agent that's incorporated in these and impregnated in these. So again, lots of good ones on the market today, but see what works, talk to your colleagues, see and take courses, see what people are using, see what works in your hands. Regardless, you need to have about a 3 to 4 minute placement for retraction cord to be effective. And that's really, really important. A note to make is, in fact, if you are doing traditional PVS impressions, you do not want to take latex gloves and touch that retraction cord, because as you place that, obviously it's around the margin. What happens is latex, the PVS material will be interrupted from the latex, and it will actually cause marginal, it just interferes with the chemistry. So of the PVS impression as it sits around the margin. So you could actually be causing more trouble by using a glove that you touched the retraction cord when you want to replace or place that. So make sure your assistants aren't using that. Use nitrile gloves. In fact, if you're using retraction cord and doing traditional impressions. For subgingival margins here, you can see the close-up view of what a double cord technique looks like. And this is pretty well the accepted rule now. And I think this just works very, very well. You're going to use a smaller sized cord, usually like a 000 or 00, to place first, and that will help to do kind of a vertical displacement. And then you're going to use a second larger cord on top of that, will be more of a horizontal displacement of the tissue. And usually that will be a size 0 to a size 2, depending again what type of tissue that you're using, and if it's fibrous, what the size of your pocket is. I mean, there's a lot of values of things you need to consider, margins, aesthetic lines, etc. Maybe where the decay was, whatever you're doing. So those are just important factors to figure out there, and how you're going to use that and place that, and what sizes you're going to use. Some of the hemostatic agents that are on the market today, you've got a great variety here. Viscostat Clear, you've got Hemodent, Hemoband Gel. These all work very, very well. I just think it's how you work with these in your hands, get a consistent style and procedure of how you're using this, and learn to master it. I think sometimes we jump over to another thing because we think maybe we can do it easier, or it sounds like it works better. Whatever, regardless, you need to really master it. And I think when I say that, use it at least 10 times and really hone it, and understand how the material works, how it works best in your hands. Really read through the instructions, give it the benefit of the doubt, really work through it, because I think sometimes we try to jump ship on thinking it's something, the grass is always greener. It's not always that way. It's really what works in our hands and works best and well. Here's a great case here with Hemoband Gel. I'm going to go ahead and rinse the preparation off. I'm going to go ahead and actually syringe this gel. It's aluminum chloride, 25% aluminum chloride, around the sulcus, and then I'm going to go ahead and take my knit pack cord and do a double technique cord, where I'm going to take a 00 first and place that, and then I'm going to use my second cord. This is going to be a larger size here, and you will always have that larger size visible here, but this has been a really great adjunct in my practice as well too. And you can see here I've got 2 different packers that I like. I like the slide packer, and I like the tapered angled packer tube from Premier. So these are just tools that I use every day, and I think, again, once you get into that standardized procedure and that protocol, that system, give it the chance to make that happen. If you're doing scans, you can see here subgingivally what this looks like with a double cord technique. Once you've taken the second cord out, the top cord out, you will still see a visibility of that initial retraction cord you placed initially, the smaller one. So again, that's just what a view of a scan would look like if in fact you're doing that, and how that appears. So again, you want to be able to see that. If you don't, then it's maybe not placed correctly. I'm going to talk a little bit about lab processing, because from that angle and that lens, it's critical to know the benefits of what you have. So to me, digital scanning allows me to afford a much better enhanced communication. The designs are better. My ceramist knows what style of contacts I like, occlusion I like, and also the offerings of what materials are available. And I can honestly tell you, it's made me a better dentist because I see my preps, they help teach me, and as well as my lab does. So it's super important. More importantly, though, it reduces any kind of adjustments I have to do chairside, because it really has minimized that, because the accuracy is just so profound. So here's a cross section of a milling burr that's used, and you can now understand the detail that these burrs have to go in when they're in fact doing their milling. And these burrs cannot get into those undulations like I talked about earlier, that sawzall effect versus like a sawing effect. So very important to understand, the smoother the surfaces you have, the better that burr is going to be able to mill, and the better that restoration is going to be able to fit. So the picture I'm showing you here right now has a lot of undulation and a lot of surface roughness. If it's much smoother, you're going to have a better fit, that burr will be able to mill better, and you're going to have a better restoration ultimately long term. Everyone says, what kind of material am I going to use here? So, typical case here, you're going to have an open margin on this crown, second premolar. Patient's going to come in, you're going to remove that, you're going to start to prep this. And again, this is the beauty of what a scanner can offer, because you can immediately see what is the thickness that you have occlusally, how much have you reduced. And this is an iTero scan here. You can see how nice the depth is on this. You know exactly what level of reduction you're at right now, and therefore you can make choices. So you think about indirect composites. I need 1.5 millimeters to clear. If I'm using lithium disilicate, again, 1.5 millimeters. Zirconia, perhaps I could drop down to maybe 1 millimeter. So again, you've got choices, and barring what your occlusal reduction shows from your scanner, you can make that specified choice and make that specified material, understanding that durability of knowing then, again, for the end result, what am I going to use to cement or bond that in with? So another factor to consider too, what's the opposing tooth have? Is it natural? Is it opposing crown? What kind of material is that? So you got so many factors to think about, but this just really helps you refine your decisions. You can see here, lithium disilicate crown I used, elect bonding agent, and Calibra Ceram was used to adhesively cement this and place this and bond this in to secure it finally. So nice case, but that's just everyday dentistry. I do want to touch a little bit on temporary cements here, because the important factor to understand here is and it's asked often, okay, you do digital workflow? Yes, I do. I scan. Then the lab mills it, and the patients are in a temporary, like I talked about, for about anywhere to 3 to 5 days usually in my practice. So I have to use a temporary cement. This is so important to understand why you need to use a material that has obviously low film thickness. You want to have something that's easy to clean up, it's retentive. But the key factor here is you want to make sure that you do not have eugenol in your temporary cement chemistry. Critical to know that you have a temporary cement that answers to postoperative sensitivity, calms the tooth down, nice to do, kind of the gingival, all of that, easy to remove. But here's what happens. If you have a temporary cement that has eugenol in it, it definitely has an effect on the bond strengths of different adhesive cements. So as you move down that line of what you're going to finally place that restoration with, you could be actually having a problem with incorporating a eugenol-based temporary cement that could be interfering with your bond strengths of your final restoration. So just by making that simple choice and change, you can make something be a lot more durable and sturdy. So again, avoid IRM. That should not be used as well either. So again, the studies show this. So I just want to be able to share that with you. So that's a simple little modification, but it makes enormous amounts of difference. Tooth preparations. Let's talk about that final placement. I like to go always and use chlorhexidine. Often I'll use a Conceptus scrub here, and you can see here, I'm just going to clean this off. Again, go back to a nice temporary cement that usually comes off within that temporary. Really minimizes your cleanup here. Here's the critical thing here too, that is we get to this restoration placement and we're finally coming down. We need to make sure that we're treating that internal intaglio surface correctly. So it's very important now to make sure you're priming these indirect restorations correctly. You want to make sure that you're cleansing them. You want to decontaminate them. What this does is it ultimately creates a stronger final bond. And more importantly, it doesn't interfere with that cementation process like I just talked about earlier, like eugenol can. So with lithium disilicate here, the surface preparation, often these come back from the lab. They've already been treated with a hydrofluoric acid that they've been ready to already have had that treated and rinsed and dried. It comes to you in its package and you're ready to place that. Often too, once we're ready to place this, I'll use like an Ivoclean that I can go ahead and scrub the internal surface, and I'll apply a silane on this surface for, again, for lithium disilicate. And go ahead and air dry that. That stays on for a minute. But it's really critical for any kind of glass ceramics that you're using that you have a silane type of primer placed, because this incorporates with the glass surface. It makes it more acceptable and ready for that cement to incorporate within that surface, and you get a much stronger adhesive bond. So critical to do that. You do not want to do any type of air abrasion whatsoever on a glass ceramic like a lithium disilicate. Zirconia, on the other hand, you can do that type of blasting and sandblasting like we talked about here with a 50 micron alumina. And often, again, a lab will pre-do this for you ahead of time, but it's nice to have an air abrader. I do have an air abrader and I really believe in them. I think they work well. Zirconia chairside, again, I want to prime this and get all that intaglio surface pristine. I want to get this the contaminants out of there with the saliva and any of the proteins. We're going to apply this for 20 or 30 seconds, rinse it and air it, and it's ready to go. So chairside now, you're going to take a primer, apply there for a minute and allow that to dry. Again, make sure you seal these bottles tightly because they will evaporate on you. You can see some of the leaders on the market today, and Premier just came out with a new universal primer, which is really exciting because this does have great studies that show it really increases the bond strength to zirconia. Now, here's what's interesting. If in fact you're not doing priming, you really need to make sure that you select a cement or bonding agent that contains the MDP, that primer. And that's a really critical element, because what happens is primers that have MDP, which is organic phosphate, it's an adhesion promoting monomer that really allows a chemical bond to happen between the cement and that zirconia. So that's a really wise choice to make sure, in fact, you are using and incorporating. So here's a Zircem, which is a zirconia specified cement, and more of us are using zirconia. It's becoming more aesthetic to use, and this is a self-adhesive cement. Phenomenal cement. I cannot say enough about it. It works extremely well. You can see here, always dispense and clear your syringe tip, so you get a uniform blending of that materials. It goes through that syringe cannon right there. I found this to be a phenomenal cement. It's dual cure. It has good color stability, easy to place. You can see here we place this in this molar right there. From there you can see I'm going to go ahead and I can cure this for 2 to 3 seconds, and then you can see how nicely and easily it peels off, and it is kind of a rubbery consistency at this point where it peels, and it really expedites the cleaning and kind of the tissue as well. So I find this to be a very, very good cement choice to use. So if you haven't tried it, I highly encourage you to do that. Nice product. If you are in fact having ceramics that are breaking, or you're having problems with just thinness on that occlusal table, again, look at your reduction. Very, very important. And really base your selection of what material you're going to use on what the patient's function is, their risk, their aesthetics, how much reduction the opposing tooth has, all of those factors. Really look at the whole picture and just not necessarily the tooth. Evaluate your bonding criteria. Look at your steps. And again, like I talked about, to master something, give it 10 times at least, and really hone it and really look and dive into what each step calls for and what it asks you to do. Look at your preparation design. You saw earlier where the flaring of that occlusal table, where those fracture points were, that would become a failure. So again, just really review what you're doing and how you're going about it. You want to optimize your material thickness. And again, that's why digital scanners, I think, are some of the best choices out there, because they're going to help you arrive at that durability factor because of that proper thickness and your choice for your materials. And again, the other thing you need to think about too is for monolithic type restorations, you do not want to have a lot of unsupported porcelain, because it will fracture for sure. And of course, the overheating I talked about earlier, or excessive finishing and polishing, that leads to fractures as well on the ceramics. And obviously, you certainly don't want to do that, because that can translate to the tooth, and then we can have a bigger problem to call the root canal situation out. So again, these are all things that you can minimize. Just look at the steps, make good choices from that. You know, the true scarce commodity of the near future will be human attention. We have to still pay attention. Even though we live in this great digital realm now, we got so many great choices, materials, technologies are at our hands. We still have to really pay attention. And I encourage you to just look step by step to what you're doing, how you're doing it, make some good solid choices. Hopefully you got some pearls from this today, and you can take this and have a good time with it and really benefit from it, and benefit with your patients too, because those are ultimately who helps all of us, and we go forward and love what we do. So all very good stuff. I want to thank you for joining me. And to receive your educational credit, I want you to stay on the program if you could, please, and follow the cue. And I hope that you have a great rest of the day. If in fact you'd like to get a material listing of what we or what I've listed here, and you're curious about that, just please email me at trostdental@gmail.com, and we'll make that happen. Have a good rest of the day, and thank you again.